Hello there, if you're ready, let's get started on your darkroom medical assessment. I've kept it this way to reduce distractions and to keep things very relaxed. Just looking at the range of tests, I'll be covering a range of functions, top and the upper body, particularly the thorax. So I'll be taking written notes as we go along. Hygiene is of paramount importance. So how have you been recently? Any problems with your senses? Any aches, pains? No fevers, coughs or colds? Well, we'll kick things off with checking your temperature. It's a non-contact device here. It's quick and easy, so I'll just place that there. Just aims itself at the forehead. Lovely. That's a good start. 36.2 degrees Celsius. Right, thankfully you have short sleeves on. I'm just going to place this cuff just above the elbow. And this is your blood pressure. Another important check. So blood pressure is a risk factor for heart disease, stroke, that kind of thing. And it can damage the retinas too. Just going to inflate now. We have 130 over 75, thank you. That sounds good to me. 135 is systolic. Systolic. Get my words out. 75 diastolic. Right, where is my vision chart? Right, so to kick things off, we have the K uncrowded near test chart. We have it at 33 centimetres, we have a Snellen equivalent. So with both eyes open, can you see down to the bottom two pictures? Right, cover the left eye with the left hand. And looking at the smallest row that you can distinguish, say the pictures that you see on that row. Okay, and cover the other eye. Same again. I've cleaned my hands, but I am going to use some gloves here. I want to move on to your ears. First start by having a feel of them. I'm feeling for any lumps or bumps, and at the same time report any areas of tenderness. Here we go. And to the lobe there, just in a little bit, I'm just going to touch the tragus and the helix. Okay, let's have a look at your ears with the light here. That's just my eyebrow cracking bit. So, looking through your ear just involves placing the otoscope just gently into the entrance here. And there we go, straight through the tympanic membrane. That is a pearly white appearance. And for the left ear. That ear is looking fine, so everything's within normal limits there. You've had no problems with your hearing, I assume. No lesions, no reported pain. Visual inspection's clear. Internal inspection's normal. Now, I'm not going to spend too long on ocular health. I am honing in just on your corneas tonight, the windows of your eyes, as these are prone to degenerations and dystrophies, particularly later in life. So, my hand held this little lamp here. sweeping the light across the cornea. I recently came across an interesting corneal dystrophy known as cloudy corneal dystrophy of Francois. Either that, it was posterior crocodile chagrin. I'm just going to go horizontally. Maybe just the early sign of a arcus. I say these all the time. Pretty innocuous things. And for your left cornea, please. Look straight. Looking for any granular dystrophies. The cornea, you usually don't have to look up or down. More tricky with the left eye, but doable. And there's just a faint arcus, just adjacent to the limbus. I can't see any apparent dystrophies. At some point you might have to just stain the eyes, check for anything epithelial. Certainly no sign of any stromal or endothelial problems though. That's going to lead us on nicely to checking your intraocular pressures. I'll just applanate the cornea. Let's use some lidocaine seen there. This is a drop of anaesthetic. It's yellow. Let's smile slightly so. Just look up to the ceiling, please. Just record the batch number and expiry date there. Okay, nice clean probe there. Just going to gently applanate front of the eye. So please just look straight at one point behind me. Don't move your eye. Just want to keep both eyes open and breathe normally. It's as simple as that. And getting 19 mil of mercury on the right. And for the left, please. ears. Lovely. So with tometry we record the drug and batch number used, expiry date, time of day, and of course the readings themselves. Corneal checks, we just had a minor arcus right and left. Arcus senilius. Let's draw that out. Okay, a little bit random, we're going to jump to a very quick cognitive assessment or cognitive function assessment. Just a few questions, you give me the answers please. So, what day are we? And the month? And the current season? What is the capital city of France? I'm going to give you some words now. I want you to give me the opposite, please. So, for example, if I say hot, you say cold. So we have in, over, black, loose, thin, smooth, start, and fat. Excellent, yeah, it's as simple as that. Right, we have a little bit more light coming here. This is just so I can analyse your face. Just a brief scan, checking for any lesions. To wear my correction with some additional magnification here. These little clip-ons. Yes, the lenses may be a little bit scuffed. I've lost my lens cloth. I need to see my optician. Right, I just want you to adopt a still head in the primary position. Forehead and temples. Glabella, around the eyebrows. Now it's going to be a bit brighter. Orbits and lids, very important. So we have to look out for any potential carcinomas. Serious things, along with orbital cellulitis. But I don't see any swelling, and you are not in any discomfort. There we go. Nice simple face scan there. It's looking clear. Right, I'm just going to have a little feel of the lymph nodes around these areas, so neck, just under the chin, jawline, and around the underside of the ears, please. should listen to your chest and lungs. So, if you're ready, breathe in normally and out normally, just at your natural pace. Now a deep breath in through the nose and out through the mouth. In through the nose, out through the mouth. And once more in and out. Okay, let's just put this on the back. There we go, just breathe in normally. And out normally. And out. Okay, a deep breath in and out. In again and out. Right, I'm just going to gently tap on the back here, have a little listen to things. Just at the upper chest here. Once more on the sternum here. Lovely, relax. I'm going to wrap things up by using the light again, so it's going to be quite bright. For some more ocular checks. First pupils, so look straight ahead please. Okay, just stare at the light in front of me. Just the light. Just going to bring the light in laterally, check the anterior angles from the temporal side. Okay, follow the light just with your eyes please. Put any double of the light, if at all. Right, it's just dawned on me that we have a colour vision test to wrap things up. Similar to the Ishihara, how this one is letters rather than numbers. As always, say what you see. Excellent, so there's no malingering there. this is the last plate. Marvellous work. That's everything. Let's have a pat on the back. Right, I'm going to let you go now, safe in the knowledge that you have passed everything. Thank you very much, and I'll see you in the clinic soon.